directives, the same requirements, whatever. So for HHS, anybody think that health reform gave us a new set of requirements? I'm telling you, it did. I mean, we've got 457 provisions that HHS has to address within that act. And that equates to multiples of projects for each provision. So, but even as large as that is, it's just another set of requirements. Right? It's just another set of requirements. So what you do is you take a look at this and you say, okay, does it impact our strategic direction? If it does, then you make a change. And then that change cascades down into your architectural plans, it cascades into your programs, it cascades into your IT investment, and then you execute all of that in response to those new requirements. And that is what the IT dashboard should reflect. And I think that that's what you'll see in the future. This is the realm of the possible, where we get away from submitting reports up to OMB, responding to data calls. And what we do is we agree that this is the information, no matter what the subject is here, whether it's defense, whether it's energy, whether it's transportation, whether it's health, whatever it is, it can fit into this model. And you report progress, you report performance, and then the dashboard is a true reflection of what you're doing. Because we all do these things. And if we're not, we should be. And so this, if you put that in the dashboard, that will give you a management tool. That will realize Vivek's vision. And that will be something that is durable for the long term. And that is what I want to do. That's why I'm constantly working with Tanya, for one, and OMB, because that is where the value is. And it eliminates arbitrary requirements for data that don't help us manage any better. And so but then you see in the middle there, you've got a data portfolio. Okay, what does that sound like? That sounds like data.gov. But what that also sounds like is, and thank you, an opportunity for us to use things like NEEM. Donna Roy's sitting here. She's a PMO for the NEEM project, for the NEEM initiative. I can tell you that everybody, from the state and local governments all the way through the federal government is now realizing what NEEM could do. There was a comment made, what was it? I think it was in George's presentation on the semantic web. Somebody asked, how do you harmonize all of the competing standards? NEEM's the answer. NEEM is a process that welcomes all of those standards into consideration. And so what you do is you take a look at this thing from a domain perspective, a domain being a functional aggregate of investments or whatever, health, energy, transportation, all that kind of stuff. And you say, this is what we agree to support. And then that's what flows up into your federated data portfolio. That's what George was talking about as the semantic web. And then if you look at the top, now the public, and guess what? OMB as well as us can tap into that data portfolio in a very seamless way. And we not only have at our fingertips our data, but we have other people's data too. So now we can really look across things, across domains, and say, this is how we can work together. And that's what open government was supposed to do, it's intended to do, and that is good government. So that's what the IT dashboard should be reflecting. That's what I wanted to reflect. That's what's valuable to me. Anybody have other perspectives? Have I convinced you? Excuse me, I'll be right back. I'm old, but I'll get there.
You know, I think one of the comments you made is that it could be used as a management tool, and I do think there's a blind spot in the data that we collect is in terms of O&M spending. I mean, you know, I think everyone here has at some point seen these investments that bulk a ton of money into O&M because they don't have to report any details on it. And you know, that's what I've seen. I think if you look at the dashboard now, you can still see it. So I think when I look at that, I think the one area that I really would like to see Vivek and OMB take a good hard look at is the way we define O&M. Because if all this stuff does go out public, if I'm the public, the first thing I'm going to see is that half our money has no details behind it.
That's a great point. And by focusing on new requirements, it was not my intention to kind of go around that issue, because we're all going to be faced with that. Because you're absolutely right. We've got a lot of legacy investment that we just perpetuate. And what this process should do, if it's implemented properly, it should expose those things that you mentioned and highlight opportunities for maybe HHS to work with EPA and not invest in a legacy application or a legacy system that we have had in the past. And then free up that money for some innovation. Open government calls for innovative approaches to things. Well, you got to have funding before you can do that. And so this is an opportunity to do that. And this is, for those of you in business, I mean, these are things that you face all the time. You have to decide, well, am I going to make this investment, and what's the return? What's the value of that investment? Now, the federal government doesn't have a bottom line that we can measure against, but we do measure against performance and services, et cetera, and optimizing the value of any particular investment. So that's a very good point, and something that we need to address in the IT dashboard. And the IT dashboard does not do that very well, but I know that's on their radar. Other comments or questions?
We have time for one more question.
I tell you, he throws a damper on everything.
I'm hoping this gets to the point that the program piece that you're seeing there. So I heard you say that there are measurable metrics, and what was interesting on the previous slide was the void at the bottom on the program piece. And so, as I was sort of thinking about it, it's like, well, now you've got to go back, you've got to get the training, use, and then the optimization of these IT tools that you're putting together to tangibly measure how the program has improved. And that's the piece that I think the public really wants to see most. Is my line getting shorter? Is my form getting processed faster? Am I getting my benefits from VA or whatever? When a gentleman earlier in the weekend was talking about that stuff. I mean, these are the things that I think people really want to see.
Yeah, that's what it's about. It's all about, and I appreciate those comments, and if we did not talk about that enough, that's what it's really about. It's about good government, and good government is providing services to people that they can see in a tangible way. And it's measuring performance. And that's, and I probably didn't focus on that.